Hello, I'm Dr Karen Wynter. I work at the MPhil Research Unit, School of Public Health and Preventive Medicine at Monash University. I specialise in the mental health of new mums and dads and their adjustment to life with a new baby. At the MPhil Research Unit, we're really interested in the bond between parents and babies. This is a really important bond, and if a healthy bond doesn't form between parents and babies, it can have long-term consequences for the baby's growth and emotional development at a later stage. Most of the research on parents and infants bonding has been on mothers. We are really interested in finding out more about fathers and their special relationships with babies. So with the help of maternal child and family health nurses in Victoria, we recruited 270 fathers from the community, and we interviewed them about 6 months after their babies were born. Some of our key findings were: fathers had a poorer bond with their babies if they had a specific type of personality, so if they were perhaps a bit unassertive or oversensitive to the opinion of others, and if they had symptoms of depression or anxiety. The relationship with their partners had a big impact on the bond with their babies as well. So if they found their partner's interactions with them to be caring and affectionate, they had a much healthier bond with the baby. But if they experienced their partners as critical towards them and towards the way they cared for the infants, they had a much poorer bond towards their baby. So criticism can be very destructive, not only to the mental health of the mother and the father, but also to the relationship between the mother and the father and to the bond between a father and the baby. So what can you do? Here are 3 things you might be able to do to help families develop more healthy relationships. Firstly, we know you have a lot to cover in your consultations with mothers and babies, but it would be ideal if you could include fathers and specifically invite them to at least one consultation. This would give you the opportunity to ask Dad how he's doing and how he's coping to life with a baby. It also give you the opportunity to talk to a couple when they're both in the same room about the impact of criticism and how destructive it can be for relationships, even relationships with the baby, and how they should be mindful of how they speak to each other and try and be supportive and positive. If it's not possible to invite fathers to a consultation, perhaps you can invite them to a first-time parent group session at your centre or at a centre near you. And this session can focus specifically on those all-important day-to-day interactions with the partner. If possible, we suggest this session is run later in the day or even on a Saturday so that fathers who work traditional office hours have a better chance of being able to make it. Even if it's not possible to have fathers come to a consultation or to a first-time parent group session, you can still chat to mothers about their day-to-day interactions with their partners. You might be able to ask mothers, do you ever feel that your partner criticises you or the way you do things, or do you ever criticise your partner and the way that he does things? And remind the mother that criticism can be very, very destructive to all the relationships in the family. MPhil for Women's Health has some fantastic resources for new parents, and some of them can be found on the website whatwerewethinking.org.au. There's also a free app for parents to download, and there's some resources for health professionals like yourself at this website. Thank you for taking the time to listen to our research. And if you want to hear anything more about the study or about the findings or any of the research that I've mentioned, please feel free to contact us at the MPhil Research Unit.